right, hello everyone. We are back for chapter 9, respectful communication in an information age. So we're going to compare and contrast models of communication, identify 4 important factors in achieving verbal communication, and then we're going to talk about the importance of it all. So think about, what age do we start to communicate? What age do you start to talk? Technically, immediately. You're not talking, but you are communicating. Babies cry when they're hungry, when they need a change of diaper, when they're tired. That's their form of communication. So we are communicating immediately when we are born. And the reason why it's important for us is we have to, 1, build rapport. We need our patients to trust us. If they don't trust us, we're not going to get very far. Obtain information concerning their progress. Confirm their understanding, not just understanding that the patient knows what you said to them, but that you understand what the patient is saying to you. Relay any important information to doctors, nurses, OTAs, family, caregivers, all of them, and educate family and the patient. You are also going to encourage and support, convey bad news, interpret information. Those are all things that you can be doing. So different models of communication. Part of your job is interviewing the patient. You already knew this. This is things that you would have been doing on your 2 weeks. Unfortunately, you couldn't go. What's your pain? How'd you hurt yourself? What makes it worse? What makes it better? This is how you gather that information regarding what exactly is going on through this interviewing process. Make sure that you're not rushing. When you are rushing, your patient will feel hurried. It will think that you don't have interest in your patient, and they'll think that it's disrespect. Take your time. Yes, you will be busy. There will be days where you will rush through it. I understand that. That is life. But the more that you're able to sit, look your patient in the eye, and really communicate with them and listen to them, the better result you're going to get. The patient really wants a knowledgeable clinician to listen and to understand what they're saying. So if you don't quite understand, don't take it as, okay, well, that's fine, and walk away. Try to really listen to what that patient is trying to say to you. Think about when you go and see the doctor. You want someone knowledgeable who's listening to you, to your complaints, to what's happening. That's what that patient is doing for you. Your environment, the patient's environment, the healthcare professional, kind of molds what your patient is going to see. So for the patient, their culture, their experience, their coping ability, the psychopathology of the patient will influence their environmental context. For us, we have our culture, we have our experience, skills to guide, our age might make a difference, and that is all going to affect the communication between both of us. We want to use questions that prompts better communication. Don't use yes or no. Are you in pain? Yes. Does it hurt when you do this? No. That's not inviting it's not an inviting conversation, I should say. It's just bland. Invite them. Use questions that promotes that communication between you and your patient. Allow them to explain it to you. And I mean, it's really interesting now that this is coming up, but because of new technology, you may find yourself communicating with patients in a variety of ways. Before, it was face-to-face. That's how we did it. But even with this coronavirus, we're finding that there's different ways we can communicate with our patient via text message, email, Skyping, Zoom meetings. These are all ways where we can talk to them now. There is face-to-face, which is really the best form of communication. That allows you to see the patient's physical and facial expressions during communication, to see if what's happening, to really kind of get a feel for your patient. That's the best way. Some doctors are using portals or email to communicate, and that kind of cuts down on some of these office visits that aren't always necessary. Quick questions that they can answer without having to be charged, which is sort of nice. I think the problem with portals is that I always forget my login for each and every single doctor that I go to. I wish it was just one, which I know is not really possible, but it happens. One-on-one allows more personal time. Again, it doesn't always happen that way, but it is nice to really sit one-on-one with your patient and have them describe to you what's happening. Always introduce yourself. You will be introducing yourself as a student PTA. You'll forget every once in a while, but as long as you're really introducing that first time, you shouldn't have to introduce every single time you see them. There are more group treatments happening, especially with the change in billing for Medicare. It's good and it's bad. I like it. They're beneficial in some settings. Rehabs do them. That allows more communication between the patients. You get more than one person done at a time, but also there's that motivating factor between other people, that others are motivating each other to get something done. Now, we've already talked about institutions and homes. When you think about an institution, I know I have written here that patients find this setting more stressful. I know that I do. I find myself more stressed out when I'm in a hospital. The sights, the sounds, the smells, there's medical devices that can really make a patient kind of worrisome, either with IV poles, cath bags, wound vacs. What else can you guys think of that can, a medical device in a hospital or rehab that would make a patient worrisome? Think about it. The home can be good and bad. It puts the healthcare provider in the patient's home and on their home turf, which can be a little bit challenging. Obviously, you're not going to have all of the tools that a healthcare professional needs, so you have to be sort of creative. But there's also this weird sense of, well, am I a guest in your home? Am I intruding on you? The patient might think like, well, do I offer them a drink? Do they go to the bathroom at my house? Those kind of things can make it a little bit uncomfortable. So just communicating what your stance is with the patient. So factors in choosing the right words and communicating effectively. This first slide basically says the way you present your material is a huge deal. Your choice of words, your tone, your clarity, and your volume. It's not always what you're saying, but how you're presenting it to your patient, along with how your facial expressions are. You need to make sure that you are watching how you're presenting this information to your patient, that your tone is appropriate, that you're clear enough, that you're not getting loud or upset. Your choice of words can make a difference depending on who you're communicating with. It will be different with a 5-year-old than it will be with a 70-year-old. And you will need to be flexible with all of your patients. Thinking on your feet and making sure that you are making it the best for each patient is important for you in this stage. So some problems with communication. We will go into this. So desired results are lost. Patient tells you, I'm in pain, and you show no signs of acknowledgement and continue with treatment. I know this seems like you're like, why would people do that? But really, I've had patients and students who have this issue that they don't take into consideration what the patient is actually telling them, and they just keep moving on with their day as if they're not in pain. Make sure that the patient's descriptions aren't too vague and you really understand what they're saying. Is it really the injury? Is it just because your muscles are sore from not doing work? Dig into that a little deeper and make sure that you are really approaching it as a true meaning and not just they're just faking it, they don't want to do the work. Meanings are confused. So sometimes our abbreviations are misunderstood, or our patients don't know what we're trying to say to them. A PE can be a pulmonary emboli or a physical education. It depends on what the patient is saying. So make sure that your patient understands what you're saying, either with, don't say ABD or ADD for abduction or adduction. You need to explain that to your patients and not just saying abduction. They don't know what that is. So explaining it to your patient in layman's term. Doubt arises about the health professional's interest. When you use big words or medical jargon, the patient gets confused. They don't want to listen. The things they don't understand. It's hard to focus when you don't understand. And I found that with my own classes or when I'm at the doctor. my doctor is spouting out words I don't understand, I find myself lost and uninterested when that's what I should be looking for. Make sure that you are really communicating with your patients in a form that they can understand. So paralinguistics is actually the study of all cues in verbal speech other than the content of the words spoken. So your volume of voice, speed of voice, tone, pronunciation, articulation, pause, punctuation. Those are all how things are studied. And our clarity and tone and volume is important. If you get too lengthy or rambling description of treatment options, the patient is going to start losing interest in what you're trying to say. Just use your layman's terms. Your augment verbal communication is giving diagrams or pictures, ways to change up how you're actually describing it to your patient. So maybe not so much using words, but just explaining it in a different form. Your patient might be too embarrassed to say, can you repeat that? I don't understand. I don't know what you're trying to say. So explaining it in different forms a few times will help. And again, your tone and volume is important in how you are describing to your patient. You can find that on page 170 and sort of read up on that on your own. So choosing the way you say it. Your emotions will play a big role in how you're treating your patient and your patient's emotions as well. There is fear of that unknown, that illness. They may not talk. They might yell. They might get angry or abusive or upset. Really, some of that is just because they are unfamiliar with what is happening. And there is a YouTube video which is interesting, so watch that on your own as well. There's some grief going on with that. Your patient might cry. That's okay. Crying in front of your patient is described as unprofessional. Have I done it before? Absolutely. There are times where I've gotten close with my patients and a family member has died and I can just feel that emotion coming off. And I have found myself crying in front of a patient. It's not professional. We are the ones who have to hold it together. But again, life happens. I'm only human. I have made mistakes before as well. Finding that right balance in when to show that emotion come forward and when to be the professional. Humor is always a good way to kind of look past some of what's happening. Making fun of yourself is always a way of hiding fear, and laughter is really the best medicine. If I made my patient laugh for 5 minutes, just for those 5 minutes, I knew that my patient felt better. So again, communicating beyond the words that you're saying, your facial expression. You don't want a resting bee face. Don't do it. Make sure that you're checking your face. Another thing is we had glass in our clinic and it reflected. So even if I wasn't looking my patient in my face and I was standing behind my patient, they might still see your facial expression just through the glass. So be careful. Gestures and body language. Folding your arms over may seem offsetting. Make sure that you're approachable. Your physical appearance. Again, I feel like sometimes I shouldn't have to say these kind of things, but surprisingly enough, I have run into students whose physical appearance were inappropriate. Trimming their beard, their hair wasn't cut, low-cut shirts, shirts that untucked, shirts that were too tight, pants that are too tight. Those kind of things you need to watch for, and you need to dress professionally and appropriate. Touch. I have always touched my patients. I am just that kind of person. If my patient is laying on the table and they have a total knee, I would tend to touch their knee or touch their arm just to know that I was there. I also learned which patients didn't like that, and I made sure I didn't do it with those patients. But that was a way of me kind of communicating with my patient that I'm here, I'm listening to you, I'm with you right now. And that made my patients feel a little more comfortable. Proximetics is the study of how space is used in human interaction. Really how close you are to someone. And if you're talking to a patient, if your patient is sitting down, you should really come down to their level. If they're standing up, you should stand up to their level. It's just a way of respect with your patients. Also, differing concepts of time. Everyone has a different way of how they tell themselves time. We work on a schedule. Some patients don't find time is as important. You will have patients who will come 15 minutes early. You will have patients who come 15 minutes late, and that will directly impact your schedule. But sometimes it doesn't really bother some of them. So just be mindful of that and try not to take it too personally. There are ways of communicating across distance with you to the doctor or other clinicians, healthcare providers. That's through diagnostic tests, evaluations, progress notes, consent surveys. Obviously now we're doing the telecommunication, which is totally different. Make sure you know that not everyone has electronic tools. I feel like everyone has a cell phone now, but it's not, don't assume that they do. Not everyone has a computer or a fax machine. I had a patient who did not have electricity. She had a cell phone, but she was living in her car at the time that I was treating her, and that was a huge deal. It made a big difference, and so understanding that with your patient. So 2 goals for more effective listening. You want to improve listening acuity so you hear patient accurately, and to make sure how accurately a patient has heard you. Those are 2 goals for more effective listening. Again, improve listening acuity so you heard the patient accurately, and to make sure how accurately a patient has heard you. And again, just reconfirming what you're saying to your patient and making sure that they understand. That is effective listening and effective communication. A patient care meeting can help if you sit down with the patient and other providers or other family members. That can kind of get everything out on the table and everyone can understand what's happening. The search for familiarity, sometimes we find a quick meaning when the whole meaning doesn't really explain the complexity. So just really explaining it to a patient how they're familiar with understanding it. And again, some people need a little longer to understand something. Some people are a little faster. Every patient is different. If one of your patients needs a little bit more time or needs you to explain it over and over and over again, it is not your job, and it is unprofessional of you to get frustrated. You just need to find a different way to communicate that information. So if you guys do not have any questions, if you do, you will always feel free to email me. Otherwise, I will see you for week. I think this is the end. Yeah, I will see you for week 4. Thanks, guys. Have a good one.